Washington County. Good evening, everyone. Welcome to the monthly meeting of the Washington County Board of Health, March 9th at 5:30 p.m. Hello?
Hello.
Yeah, you guys on speakerphone, mute your phones if you can till we address you. Can you both hear me?
I can hear you, yes.
Dr. Clark?
Yeah, I hear you.
Okay, can you hear me though?
Yeah, I hear you.
Okay, thank you. Okay, welcome to everyone out there, including the live streamers. In person, we have Dr. Patey, Nat Sistrunk, myself, Bruce Kelbaugh, and Jeff Jones, and also Nicole Coyle, the Washington County Prosecuting Attorney, and Jeanette Farnsworth, the Director of the Washington County Board of Health Physical Department. Okay. And we have a couple visitors. The first thing we want to do is go through and see if there's any changes to the agenda. One of the things that I noticed that was left off is the election of Board of Health officers that happens in April of each year. So that will be added under, well, actually, we'll probably do that initially. I spoke with Josh regarding his continuing education and asked him if we could table that to the next meeting since it was not an emergency, and he was happy to hear that we were doing that. Okay. And also the Kelly Miller contract, who does contract restaurant inspections for us as a sanitarian. I asked Josh if it was okay if we tabled that to next month since they can't really do those inspections right now. And he said, great, so that will be tabled also. So do any of the other board members have anything they would like to add, make changes to the agenda? No. No. Okay. The first thing we're going to do then is do the required election of officers for the Washington County Board of Health for President and President Pro Tem for the next 12 months. And I've been advised by the prosecutor that it's something I can go ahead and do, so I'm going to go ahead and conduct that meeting. So I'm going to open nominations for President of the Board of Health. Gentlemen, your pleasure.
I nominate Bruce for president.
It's, okay, there's a nomination by Nat for Bruce Kelbaugh for president. Is there a second? Okay, second by Jeff Jones. Is there other nominations?
Nominations be closed.
Okay, Richard Daniel recommended nominations be closed. Is there a second?
Second.
Okay, motion approved. Okay, all those in favor of myself, Bruce Kelbaugh, as the president for the coming year, signify by saying aye.
Aye.
Okay, motion passed. Okay, the next office is the President Pro Tem, and I'll open that up for nominations.
Yeah.
Jim.
Oh, come on, guys.
Okay,
Richard doesn't want it.
you nominate Nat Sistrunk. Okay, Nat Sistrunk has been nominated. Is there a second?
Second.
And it's been seconded.
So moved.
Okay, Richard moved and Jeff seconded. Nominations. Those in favor of Mr. Sistrunk for President Pro Tem signify by saying aye. Aye. Congratulations, sir.
Thank you.
Okay. The consent agenda. Is there anything that the board members would like to move out of that before we just consent to it being approved? Jeff?
I don't have issues.
No? Okay, I just have two quick questions, so I'm going to be removed. The rest of the consent agenda, I will accept a motion, entertain a motion that we approve the consent agenda.
Reports Chairman's motion to accept the consent agenda.
Okay, Nat has motioned that we approve that. Is there a second?
Second.
Dr. Patey seconded. All those in favor signify by saying aye.
Aye.
Okay, motion passed. Okay, the department reports, I think the only one we didn't have was nursing because Val had a good excuse. She became a grandmother again. And you gentlemen that are here should have gotten a copy of the report tonight. Are there any, do you have questions about anything she has in her report?
No.
Val, and you want to bulletize?
You're gonna notice for the next couple of months, our immunizations are not gonna be up to snuff because of the decreased traffic everywhere. Other than that, wanted to point out the CHARM program. I do not have numbers for you today due to somebody else doing the program for me this past week while I was off. Jan Powell's a nurse that is a member of the church where we hold the program
Right.
and has volunteered to help on occasion.
Okay, fantastic.
If I could ask, the vaccinations, I understand why they're down, but if somebody still wants one, they can contact the.
Absolutely, and we
Make
will make
arrangements.
yeah, absolutely.
Very good.
Absolutely. The only change we've made is we're closing at 4:30 on Wednesdays instead of 6.
Great.
But if somebody would call and need an immunization between 4:30 and 6 on Wednesday, we can accommodate.
Great. Thank you.
Did you, the influenza vaccine, did you ever require any more?
We did we did acquire 50 more doses. So if you know somebody out there that feels that they really ought to get that, yes, it's available.
Thank you, Val, and congratulations on being a grandmother.
Thank you.
Okay, I should mention that Les, I'm not sure of her last name, but she's here from the county IT department, and she is the brains behind this live stream. So thank you very much. Okay, going down the agenda, does anybody have any questions about any of the other reports that you were given in your packet? Dr. Patey?
No.
Okay. Okay, hearing none.
Bruce,
Yes, sir. Yes, sir.
I have one question. I noticed in the administrator monthly report, it says that the up-to-date employee list is provided, and there was no list in my report, so I don't know if that applied to anyone else or not.
Yeah, I think that fell through the crack. I will get everybody a new copy because I didn't receive a copy either, but we'll get everybody a copy, Richard, and thanks for mentioning that.
Yeah, I'm trying to make sure that we know who is on the payroll at, a certain date.
Certainly, I will work on that. Thank you, sir. Jeannie, on the fiscal report, in 25 words or less, how would you summarize our standing right now? Because I know there's a lot of unknowns as far as receipts coming in, et cetera, but would you say we're healthy for now?
Coming into this year, we were in a very healthy position. We were able to, we had 3 months worth of operating cash in all of our funds. So while we do see revenue, cash-wise, I think we're fine for a while, especially with the COVID-19 grant money coming in to help supplement some of the activities that are going on.
Okay, thank you, and all the rest of people at the health department are doing all they can to get us through this crisis that we all face. Thank you. Question? Adam, wait.
Yeah.
Okay, moving on to old business. Kelly Miller contract is being tabled. We'll take that up next month, and Joyce was going to tell her about that. Revisit the handwritten employee manual resolution that was tabled last month. If the rest of the board wishes to entertain that tonight, we can do that. If you don't think it's super emergency, we can table it until next month. It's whatever you folks decide, three of you. Speak up.
I'm okay with making this meeting brief in comparison to.
Okay, sir, you making a motion to
I'll
table
make a
to
motion to table that review.
next
Someone
month?
else has objections. Next meeting, we'll read.
We'll have to get. Okay, Dr. Katie seconds that. Discussion. All those in favor signify by saying aye. Aye. Okay. Under new business, Jamie, I just have two really quick questions on the bills. Oriana House, where we paid them $1,600 for charm.
It's not $1,600 like per week. It's so much per. It's so much per week, and $1,600 is like an aggregate amount because they hadn't invoiced us for a while.
What is it they do, just real quick for us at that program?
They are the ones that try to get the people that are coming to the charm program to think about recovery,
Yeah,
entering
program.
into a recovery program.
Thank
It's
you
a
very much.
certified addiction counselor that they provide.
Okay, thank you, Val. And the last question I have is Perry County, $3,750 per, right,
And that's for them doing their county.
okay, so we got the award and we're sharing it with the other counties.
Right.
Okay, thank you very much,
Mhm.
very clear. Okay, new business. Our administrator, Mr. Kaufman, submitted his resignation on 4/7/2020 after our special meeting, effective immediately. So I have a copy here. I don't think we've seen it. Pass it down to Dr. Payne because he didn't make that meeting. Entertain a motion to accept that resignation.
I'll make the motion to accept the resignation.
Okay, Mr. Sistrunk makes a motion to accept the resignation. Is there a second? Okay,
I'll second.
okay, Richard seconds that. Discussion. All those in favor signify by saying aye. Aye.
Aye.
Okay, resignation accepted. Roger, thank you. Okay. We're into budget actions, and there are, I think, 5 of those here. The first one is FS 2020-006, and Jeannie, our finance director, fiscal director, is going to in 25 words or less tell you what that's all about. Before
006, what's the fund at the top of it?
Ebola and emerging pathogens.
That is the COVID-19 grant money, $55,000 that ODH is giving us, 17,788 of it earmarked for Marietta Belpre Health Department.
Can that be used for PPE equipment?
It can if we can find it.
I understand.
Yes, it can be used for PPE. It can be used for staff time. We have money budgeted for supplies, a small amount for travel for site visits if Josh or the nurses need to go somewhere. We can take 10% MTDC, which we are doing because we're not allowed to pay for any of the triad out of that. That's our director of nursing, our director of environmental health, and our administrator. So the indirect will pay for their time that has to come out of the general fund, or at least a good portion of it.
Okay, I was going to ask you about triad funds, and you answered that, so thank you.
So
Okay, is there a motion to approve FS 2020-006 regarding Ebola and other emerging pathogens, and it's for COVID-19 funds?
I'll make a motion.
Okay, Mr. Jones makes a motion. Is there a second?
I'll second.
Mr. Sistrunk seconds. Questions? Dr. Payton?
I got one, this is coming from ODH, correct?
Yeah, yes,
Okay, the questions was, is it coming from ODH, the money, and that's yes, according to Jeannie.
yes.
So, no discussion, all those in favor signify by saying aye. Aye. Opposed, same sign, motion passed. Okay. You seconded that, right?
Nat seconded it.
Yes, I would. Okay, I'm going to pass this around and one of you have to sign it. The next one is FS 2020-007, which is community health workers. And,
The community health worker program is done.
right,
We had advanced $20,000 into there to give them operating capital because it was a reimbursement grant. And now that it's done, we want to put that money back into the general fund.
super. Thank you, Jeannie. Any, is there a motion to approve FS 2020-007, community health workers, putting the funds back into the general fund because the CHW program is null and void?
Yes, I'll make that.
Okay, Nat makes a motion. Is there a second?
Second.
Dr. 80 seconds. Any questions? All those in favor signify by saying aye.
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 All those opposed, same sign. Okay, thank you. And the next, continuing with budget actions, is FS 2020-008 regarding District Board of Health.
Okay, that contains several things. We received $5,000 supplemental subsidy from ODH. We will be receiving the indirect costs and from the COVID-19 grant, and then we are putting between the community health workers and the PIRE grant, closing $50,000 back into there, and then we're appropriating some additional salary money to pay for the triad time. But overall, it's still going to increase our general fund. Down at the bottom of that page, it's a positive number, like $30,000. Is that what it says? $30,000 estimated change in estimated resource.
18,000.
Yeah, 18,000. It'll increase. You know, at the end of the year, our general fund should be $18,000 ahead of what it's currently estimated to be with those changes.
Okay, when you say triad funds, what will we, is that for COVID-19 or is that just triad funds?
It's just COVID-19
COVID-19.
because we've already spent some money. We can't get reimbursed from the COVID grant for Josh, Val, and Roger's time that they spent.
Okay,
So that indirect costs and the $5,000 that we've already received will help cover those.
okay. Thank you, Jeannie.
Mhm.
Okay, is there a motion to approve FS 2020-008 District Board of Health amended certificate?
I'll make a motion.
Okay, is there a second?
I'll second.
Okay, are there questions? Okay, all those in favor signify by saying aye. Aye. Motion passed. Okay, we have a couple more left here. The next one is FS 2020-009, which is the PIRE program, which is no longer, what's the word, Jeannie?
It's no longer active. It's
No.
been terminated.
Okay, the program's been terminated, and there's an amended certificate for that. And it looks like we're gonna get like, it's taking 8,777 out of general, is that correct?
No,
It's in parentheses.
it's in parentheses, but that's just that fund. It's not the general fund.
Okay,
It doesn't, we're putting $30,000 from that fund into the general fund because we had advanced it into there at the beginning of that grant year.
got you. Thanks for straightening me out.
Mhm.
Okay, is there a motion to approve the PIRE funds transfers?
Motion to approve.
Okay, Dr. Payton made the motion. Is there a second?
Second.
Okay, discussion, questions? Okay, hearing none, all those in favor signify by saying aye. Aye. Motion passed. Okay, I guess we have two more as best I can tell. FS 2020-010, which is FAP Emergency Preparedness. Jeannie, you want to comment on that one real quick?
There was money left over from the previous grant year at the state, and they distributed it by region. There's $65,000 to address things that the region, that's the 11 county region that we're in, needs to strengthen their ability to respond. I believe that they mostly want to buy more aeroclave units, which are portable disinfectant units, maybe another Zumro tent or two for mobile command units, and maybe some more disinfectant, which is a supply, and some Wi-Fi boosters or wireless signal boosters. Is
Or about PPE?
not out of this.
Can't do that?
No,
Okay.
because it's not something that was identified as a shortage by the region in a previous exercise.
Okay, so this district committee of multiple counties, they'll vote on how they want to spend this, correct?
It's limited by what they have identified as possible shortages on previous exercises. So these are things that they have identified as needs in the region based on activities and exercises that they have already done.
Okay. I know the answer is probably going to be no, but I'm going to ask Crystal, since we're in a state of emergency in the state, would they consider allowing us to add to that list? If we can't, that's fine.
You can ask her. It has to be spent by the end of June 30th, and they kind of had their list.
Okay,
And PPE, I'm not sure we could
get it by then.
get it by then.
Okay, I'm good. Okay, is there a motion to approve FS 2020-010 FAP emergency preparedness expenditures?
I'll make the motion.
Okay, Nat makes a motion. Is there a second? Second. Dr. Patey seconds. Okay, discussion, additional questions? Hearing none, all those in favor signify by saying aye. 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 Motion passed. And now, let's see,
Is that the cash advances?
I'm sorry,
011, is that the cash advances?
it's the spatial project.
Oh, special project, okay. Good, I was afraid I forgot that
I want
one.
to give us a real quick dissertation on that.
We have $8,000 of money from Health Path Foundation, which is out of Cincinnati. Sherry's using that to conduct engagement, like community engagement, and then we'll get some coaching on how to do that. Conduct 3 listening sessions, and then they'll have some money of it left over to whatever those listening sessions decide we might need to put towards that.
Okay, thank you. I think that's good because that gives us the opportunity to hear from our constituents and respond to that. So motion to approve FS 2020-011.
I'll make the motion.
Okay, is there a second?
I'll second.
Okay, are there questions, additional questions? All those in favor of the 2020-011 being passed signify by saying aye. Opposed, same. Motion passed. Thank you.
Last one.
And this is the last one, budget adjustment resolution.
And then it doesn't have a specific fund. That's the actual cash advances from, there's $20,000 from community health workers to the general fund, $30,000 from PIRE into the general fund, which is a total of $50,000 into the general fund, and then $25,000 out of the general fund into the COVID-19 grant funding, that Ebola and emerging pathogens, as operating capital so that we can expend it and get it reimbursed. And then at the end of that 25,000 would get back to the general fund.
Is it fair to say that this just summarizes all the resolutions we passed authorizing you to make the transfers?
Yeah, it's just the cash part of it.
Okay. Motion to approve.
I'll make a motion.
Second.
30 seconds. Questions, discussion? All those in favor signify by saying aye.
Aye.
Motion passed. Okay. New business, job offers, tobacco prevention. So there was somebody identified to make a job offer to.
We interviewed 4 people, and at least 3 of them, and maybe all 4 would be really good additions in various roles. We identified one person that we would like to offer the job to. His name is Brian. He's looking for a career, just out there, we thought he would fit in well. And if the tobacco grant were to not be continued because we haven't been able to finish it out for the year, we also thought that he might be one that Crystal would want to interview and move laterally into the local planning position, that he might be a decent fit for that.
Good question. Well, I guess we should do this legally. Motion to approve the job offer for tobacco prevention.
I'll make a motion to approve it.
Okay, motion second. Second will allow us to discuss it, and then we can vote either way.
Second.
Okay, second. Yeah. Discussion now. My question to you, Jenny, you said if that grant goes away because we haven't been able to finish it.
Mm-hmm.
So the little girl that was working on the Marshall program, paid by Marshall, I can't remember her name,
She was able to do a few things.
the deliverables, we didn't meet the deliverables.
There are deliverables due essentially every month. And Stephanie worked through like October, maybe into November. Josh, I'm not sure that he actually really got the hang of it. It really wasn't his passion.
Right.
Carla got a couple of media campaigns going, and there were store audits done, but there's a lot more to the grant than that, and I'm not even sure what all we are so far behind on. There's readiness assessments and community group, like contacting schools, contacting various civic leaders, government organizations, businesses to try to influence policy. There's special populations that are supposed to be contacted, and I'm kind of at a loss as to even what all there is to do, let alone what all we've missed doing.
The gentleman that you felt a strong candidate, forgive me, what was his name?
His name's Brian.
Brian.
Mm-hmm.
What is his background? Were you part of the interview process?
I was part of the interview process. Yes, he. We've all slept since then. Yes, he has in the insurance industry as a claims adjuster, title abstractor. He has 30 hours of news editorial study, 21 hours of business administration, associate in applied science and computer information technology, customer
Do you feel like
service.
he would be someone to kind of step into this and Go with it.
I think that he would be a good fit for our department. He was the one that we thought was probably the most flexible, and that with our real need to have somebody that's going to come in and be stable, he struck us as a very level-headed person that makes good decisions, that isn't going to burn out and up and leave.
Jeannie, I know you don't have any more room on your plate. Is there anybody that I can talk to find out? Whoever offers this grant, I don't know if it's from ODH or who, that I could talk to find out where we're at in the process and what we would have to do to resume it.
Kinsey, her name
No,
is Kinsey,
Just shoot me an email.
right?
And the next, because I want to find out how pressing is it. If we have to fill this position in the next 30 days or lose it, I think it's important.
So that they can, because they're in the process of reviewing grants, I don't know that she knows how that review process is going. It's my fear, because from a compliance standpoint, we aren't really meeting the deliverables. The last email that we had from her told us to just, because of the COVID-19 stuff, she knew we were really busy and not able to get much done.
But if he's able to hit the road running, he very well could catch us up.
He could get some things done that are still out there to get done.
So was there unanimous? Did everybody that interviewed agree unanimously?
We put them in order. Yes, we agreed on an order in which we would like to do the offers. We liked him best because we thought he would be the most flexible, most likely to stick around. And if we lost the grant, and got along with Crystal, be another position for him to be able to step into, rather than give up his job and then be done at June 30th because there's no work.
Can you forward me that email from that lady that said just take a break so I can?
Yeah, I'm not sure that was the exact words, but sure will.
Okay, well, I know.
Yeah.
Additional questions? If we have a motion in a second.
I don't have any, Jeannie, the other staff comfortable with it.
And the other thing would be, if he decides that this is not a good fit for him, can we offer it to the second person without coming back next month for approval?
The job approval sheet was not in my packet, so what are we offering?
It's 16 an hour,
Okay, 6 months probation.
6 months
Standard-
probation.
standard,
Mhm.
And it's grant money.
It's grant money, yes.
Okay, I haven't thought this all the way through, but all those in favor of approving this job offer signify by saying aye. Aye.
Okay.
Didn't ask
Just
for a
to
second.
clarify, Jeannie did specify whether or not you want there to be a conditional of the second candidate should the first one not accept the offer.
That needs to be clarified.
How far down is the second? If the top one's 100,
Yeah.
any potential for Crystal in that one?
That's second, because the potential isn't as good there.
Okay,
It'll be what it be, unless we need to fill that short term.
Mhm.
And then we still offer the local planning position to our first choice, if that's something he would be interested in, when Crystal's ready to put somebody in there.
okay. We can make a motion to approve that. I'm gonna recommend that we don't, because I don't like taking second best. I hope that we can get him, and if we can't, then we can deal with it.
puts us out of money.
But if Brian had the offer,
I would have offered it
I
to
think
him.
that's
I
the
think
question.
so. Yeah, we would
We
have.
have an ideal choice, but we have a functional choice. And I
Okay.
think we should consider that as a backup.
Okay, is there a
Because
motion?
timing is,
Is there a motion to do that?
I'll submit the motion that
Okay, Matt makes the motion that we allow him to move down by Dr. Katie seconds. Further discussion? Aye. Aye. Okay. I have two items under new business that I'd like for the board to consider adopting. Number one is because we don't really know what the impact's going to be on revenue, like nobody does in government right now, to the board to go on record that only essential spending be done until we get a grasp on this emergency situation.
they could go.
Well, I'm not, but, to me, it should be something that requires us to serve the citizens. It shouldn't be a luxury right now. I don't know what that might be,
Yeah, I don't know what,
but,
or what we're cutting out.
well, basically, we're just asking them to only do essential spending. And what I would ask is if you authorize that, authorize me to answer the questions. If it's hot dogs and beer on Friday, I can probably handle that as a joke. If it's something I can't handle, I'll go back to the board and solicit input from you before we do it. But I just think we need to caution of other expenditures.
Is there something on the list of things that we're doing that you would consider non-essential, so we can have some examples?
There's nothing I've seen.
And are you suggesting that we get your signature on any purchase orders that we might want to get issued?
No, I'm not saying that.
To decide whether or not it's essential on a day-to-day basis.
Dr. Clark, are you there? Dr. Clark?
Yeah.
Okay.
Yeah.
Regarding purchase orders, vouchers, payroll, time cards, et cetera, is that something you would consider assigning someone to do as health commissioner? Which I think you're authorized to do that.
Yeah, I would find someone that way and get done in the time.
Thing that you would designate.
Whoever's most qualified to do that there, I mean, the logical choice would be the administrator. If there's not an administrator, then I would say Jeannie.
Okay.
Yeah.
Judy already said,
That he would appoint me?
yes,
Ta-da.
Ta-da. Can we time out for a second?
sure.
The battery just died on the camera.
You're not joking.
I'm not
I
joking.
won't be on the hot mic.
Audio still works. Audio still works?
Thank you.
Okay, so the camera's down. Now, to sign vouchers, we still have to have the health commissioner to do that until and unless needed.
I think he'll be available, just not, I mean,
Right, and he
24
has,
hours or 48 hours.
right, he has made himself available to sign vouchers Friday, which we appreciated a lot.
I mean, like, just a little bit more. Sign about.
Assuming you're implying that you're talking about future expenditures, you're not in any way jeopardizing prior contracts,
No.
or even if they would no longer be deemed essential now, like you're in a firm contract, you're not in any way.
No, I just know that all governments, counties, state, everybody's worried about the receipts. And we should let the people we serve know that we're essential service and only essential purchases. Not a major deal. Les, are we back on?
No, the battery's dead. I don't have a way to
So it's done.
fix that. I have audio, so it's still being recorded and broadcast in that manner, but no.
Okay, well, thank you.
So to clarify, we haven't identified any non-essential.
No, I'm not aware of any. It was just a general statement. I withdraw the request. Okay?
Okay,
Perhaps just a recommendation, we do our best to run a tight ship.
absolutely.
I'm going to recommend that we go into executive session to discuss employment. And roll call for that, for yea or nay. Nat,
Yeah.
Dr. Payne,
Yes.
and Bruce, yes. Okay, Richard,
Yes.
Clark, you and Richard can stay on these phones if you'd like. Yeah, yes.
I'm fine with that.
Okay?
I'm fine.
I have no idea what time it is.
6:15.
Okay, it's 6:50. We're going into executive session to discuss.
Just returning.
So are you cutting that off in terms of the audio at this point?
End the stream.
Yes,
So
until we come back out.
So